Good morning. I'm Dave Anderson, and I serve as chair for the Kansas Behavioral Sciences Regulatory Board. I ask the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted in hybrid form. With some individuals remote by conference call or other electronic medium, and some individuals present at the board's office. Denise Seisman. Jill Flessing.
Present.
Linda Heitzman Powell.
Present.
Donna Honer Queel.
I see her logged in.
Mary Jones.
Here.
Jim Kilmartin.
Here.
Richard Nobles.
Here.
Andrea Perdomo Morales.
Present.
Cynthia Schindel.
Present.
Laura Shaughnessy.
Present.
David Stevens.
Present. And Dave, could you scoot the microphone closer
Yes.
to you? We can't hear you very well.
Okay,
It's the owl.
We don't need them.
it'll be really close. How's that?
You have a really low.
Is that better?
A little bit better. Not much.
It's still pretty faint.
Need you to speak into the mic.
Okay,
Thank
I
you.
note the following staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Cindy.
Here.
She's remote.
Just gonna get some help with that last name.
Schindel.
Tim Resner, serving as legal counsel for the board, is also present.
I'm here.
Okay, thank you. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Dave. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the board to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. No individuals requested time for public comment at this meeting. Because we are conducting this meeting in hybrid form, I state for the record the following information. Access to this meeting is being conducted in person and by a medium of interactive communication that allows members of the public without cost to attend the meeting in person or through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted in hybrid form, the requirements of KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On March 5th, 2025, we sent notice of the board meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And we did check the conference call line before we got started. There was no one on the conference call line, but if someone logs in and introduces themselves, we will let you know.
Thank you, Dave. The meeting is now called to order and the board will begin its discussion of the first item on the agenda. The first item is approval of the agenda.
So moved. Second.
We have a motion and a second. Is there any further discussion? Hearing none, all in favor of the motion, please say aye.
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 Opposed, same sign. Motion carries. Thank you. Next, public comment.
No individual requested public comment at this meeting.
Very good. That takes us to review and approval of the minutes from our previous board meetings on January 13th and February 24th, 2025. Any additions or changes to the minutes of either of these
I move to approve the minutes from January 13th and February 24th.
Thank
I'll
you.
second.
Thank you. We have a motion and a second. Any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. That moves us to our executive director's report. Dave?
Okay, thank you, Dave. Let's go ahead and start with some updates on BSRB operations. And let's start first with outreach. So I do try to keep the board informed of what individuals that are listening to the meetings or viewing the meetings on our YouTube channel. As of now, since we started the channel back about 4 years ago, we have broadcast or uploaded after the fact about 195 meetings that have been viewed 10,855 times. About an average of 56 views per meeting, although some are definitely higher than others. Also under operations, one of the things that we value here is outreach to students. As they are preparing to become licensed professionals, we feel like it's very important to help them understand the application process, make sure that goes as smoothly as possible for them. Let them know their responsibilities as a professional in terms of unprofessional conduct so they can avoid some issues there. And then also let them know about the resources the BSRB can provide for people. So in sort of the back end of my report, I included a number of different opportunities that we had to speak to students. I actually forgot a couple of those. And so, but Leslie and I have had a lot of really good presentations recently, talked to a couple of different groups of social work students at Wichita State. I did a presentation to psychology and social work students at Washburn in 2 different presentations, spoke to counseling and psychology students at Kansas University, and then also did a presentation to counseling students at Mid-American Nazarene University. So we may do a few more of those before the semester wraps up, but happy to help those individuals get a good head start on their professional careers. Concerning outreach to licensees, I do want to thank everyone for filling out those surveys that we had sent out. We had a very ambitious project that we worked with the advisory committees on in the fall, and that was to put together surveys for 6 of the 7 professions. We have done surveys historically for the social work profession. The advisory committee did a survey last year and then did a survey about 2 or 3 years before that. We did go ahead and put together a survey question for each of the other 6 professions this past year and sent that out in January. When we were about to wrap it up, we heard some requests to hold it open a little bit longer. So in total, we held that open for just about a month from January 24th until February 23rd. We collected a lot of really good information in terms of what licensees are seeing out in the field in terms of unprofessional conduct, issues involving supervision, telework, but also we wanted to use this as an opportunity to provide good data to more clearly help understand the workforce. And so we've put together, or we're in the process of putting together reports. We tried to standardize those questions as much as possible, understanding we would need some unique questions per profession, but a few of us here in the office are working to summarize that information with the goal of having a report for the advisory committees in the April meetings, 1 per profession, and then a summary report where we give highlights and summary information comparing across professions. So as I mentioned, this was a very ambitious undertaking. We had thousands of people that responded to the survey, so we were really happy with the feedback that we received, and we will let you know the results of that survey once we can put it into a form that we can distribute. And then we are able to do that. We'll post that on the website as well for the agency. Concerning an update on revenues and expenditures, we started this year with about $1.9 million in our fee fund. This year, when you take into account revenue and expenditures, we are right around $1,860,000. And so we do still have a few months left of the fiscal year, but we are in good shape financially. I'll give an update in terms of going in front of the legislature this year, but just wanted to give you an update of where we currently sit in terms of our fee fund balance. Just a reminder too, our yearly budget for the agency is about 1.2 million. So our fee fund balance is about 1.5 times our current yearly expenditures. In terms of other operations updates, I did want to let you know as far as our implementation of the agreement with CE Broker. This was something the board wanted us to move forward on in terms of contracting with that company to provide a service to licensees that allows individual licensees to upload documentation of continuing education so that they're pulled for audit. That process can go very smoothly. We have 7 professions, and so we implemented that in 3 different groups. And that was fine. The last group to implement that was in January. So since that point, we are encouraging more and more individuals to continue to sign up for that. And so far, most of the feedback we received has been very positive. Also, we are transitioning to the new licensing platform with Acela. Leslie and a number of other staff members have done a lot of work talking to representatives of the Office of Information Technology Services, OITS, as they're doing discovery to put together information to capture all of our current processes and our forms so that they can make sure when they transition to the new platform, they can make it an efficient process and avoid overlap of questionings and different things like that. So there's a lot of work going on behind the scenes. Most of it's not going to be visible until we start getting close to testing the new licensing software and moving that direction. But given how many professions we have and how many different license types we have, probably our original estimate of about 2 years to make that transition is probably going to be accurate. So we probably have about another 1.5 years left as we're going and doing discovery. And then ultimately, they'll be building things for us, testing it before we can go live. But really excited about that. Also, I did want to let you know in terms of operations, I want to thank the members of the board who've recently served on hearing panels for the board. We used to go ahead and have all board members serve on those hearing panels. We went ahead and changed things about 1.5 years ago to have a subset of the board serve on those panels. So thank you to the individuals who have served so far. We do need to schedule a couple other hearings. At the last board meeting, there was interest for the board to go ahead and poll board members' availability, and based on availability to go ahead and schedule which board members would serve on those hearings. So if there's no objection to that, we will continue to do that as we get requests for hearing. If you'd like to use a different process, you're welcome to. But it sounded like last time that was the board's interest, and I think that makes a lot of logical sense too. Concerning some legislative updates, we'll move on to that category. Concerning the agency's budget, I do try to let you know how that process goes every spring. We have to submit a budget request for the agency in the fall of every year by September 15th. The legislature does not provide the agency with any money for operations, but they do have a role in terms of setting a limit on how much we can spend. And so we are one of the smaller agencies. We have one fund, but we try to be good stewards of the money we receive from license revenues. And so we submitted a budget about $40,000 under what we were approved for this past year. And then we put in a little bit of money for increases in 26 and 27. But when you compare each of those amounts to what we were approved for last year for 2025, we still came in below what we were approved for in 2025. So we got a couple questions about different operations elements on the House Higher Education Budget Committee, but they didn't have any recommended changes. And ultimately, they recommended the same amount that we had requested. And the governor's recommendation was also the same amount. I think I've told you in the past, the legislature is using a different process this year for budgets. So traditionally, agencies submit budget requests. The governor provides a review and recommendation, and then the legislature takes it from there and makes adjustments. This year, the governor is still making a recommendation, but the legislature had a special committee that met in the fall and came to an initial starting point for their process. And so they used that for the budget committee. So they are still collecting input on what the governor has recommended. So the House went ahead and went with what we had requested. They put that into an appropriations bill, which is House Bill 2007, and that was passed on the House floor. So that bill was referred to the Senate, and it is in the Senate Ways and Means Committee. What Senate Ways and Means decided to do this year was, rather than have a separate budget hearing for each agency's budget, they decided that they would pick different agencies to have budget hearings. And if there was, no supplemental request or very little of note, that would be very complex about some of the budgets. At least that's my interpretation. They did not get individual budget hearings. So for the BSRB budget, we did not get a hearing on the Senate side, which is perfectly fine. My understanding is that they will attempt to conclude their discussions on agency budgets this week or perhaps next, and then they will vote out their appropriations bill and then run it across the floor. So as of right now, there's no unique items to the BSRB. If there's any global items that would affect all agencies, we'll be tracking that. But as of right now, most of the work on the budget for the BSRB is concluded for the year. Moving next to different legislative items. In the fall, the board met and talked about different items the board would request in legislation. I did go ahead and speak to the chair of the House Health and Human Services Committee back in December of last year. I received permission to speak with the representative from the Office of the Reviser of Statutes to have the bill drafted. We did have discussions about which items would be included, and I wrote a preliminary example that she could work with, the individual who was helping us in their office. Unfortunately, based on the number of bill draft requests they received, by the time the bill was available for us to introduce it in committee, and I made efforts to have it introduced in the House Health and Human Services Committee, we weren't able to get it introduced before the deadline. And then other efforts to have it introduced in an exempt committee like House Appropriations and Senate Ways and Means were unsuccessful this year. So I do think this is just a perfect storm of some unfortunate events. I don't think it will be a trend. I don't think this will happen next year. But I do think, I think the legislature is changing some of their processes. I think they're going at a much quicker pace. But this was something where it just kind of came down to a few different processes that were out of our hands for the most part. And so unfortunately, we weren't able to get the bill across the legislature this year, but the members of the legislature that I did speak to about those items, they sounded like they would be supportive of it. It just sounded like there was an interest in the bill maybe going forward next year instead of this year. So I apologize to you all. I'd like to go ahead and get those through whenever the board wants those to be heard in committees. But we made several attempts this year, and unfortunately, it'll have to wait till next year, I believe. Concerning other items of legislation, I do try to keep you all informed about bills that might affect the BSRB. And so I just want to touch upon a few of those. At the January meeting, you recall there were some individuals who did public comment requesting support for a bill that would license art therapists. That bill was House Bill 2072. It was introduced in the House Health and Human Services Committee, but it did not receive a hearing, and I don't think it'll go forward this year. There was also a bill, House Bill 2274, and what that bill would do was it would remove a requirement for the word active for military service members in terms of getting occupational licensure, and also waiving military spouse licensing fees. That bill did pass the House, and it's in the Senate Veterans Affairs Committee. Just to let you know, if that bill does pass, the effect would be that we would be issuing licenses to military spouse licensees. Currently, right now, we waive fees if they are a spouse of an active military member. If this bill passed, we would be waiving fees for spouses of active and inactive military members. So there would be an effect on BSRB revenue. We can't quantify that because we don't have totals of how many individuals are currently licensed that fall in that category. But I don't expect that that total would be significant, that we would have to make adjustments for that. But that bill has only passed one chamber. Just wanted to let you know where it currently sits. Senate Bill 63 is known as the Help Not Harm legislation. We did talk about that just briefly at the last special board meeting. That would restrict the use of state funds to promote gender transitioning, prohibiting healthcare providers from providing gender transition care to children whose gender identity is inconsistent with the child's sex, and authorizes civil cause of action against healthcare providers for providing such treatments. We have received a few questions on this bill. It did pass the legislature. It was vetoed by the governor. Then the legislature overrode the veto, and it has now been published in the Kansas Register. And so based on the wording of that bill, it is now effective. And so we are continuing to work through the different language in that bill. The BSRB does not provide legal guidance to licensees, but we are trying to make sure that we have a good understanding of what's all included in that bill in terms of our responsibilities under the law. Senate Bill 128 would create an exception for certain mandatory reporting obligations for social workers when they are working under the supervision of an attorney. That bill did pass the Senate, and it will receive a hearing in the House a little bit later today, actually. Senate Bill 229 would create a sunset provision for occupational licensing requirements, so they would automatically terminate after 5 years, unless explicitly extended by the legislature. However, that bill draft exempts several agencies, including the BSRB. It has not had a hearing. It was referred to the Senate Ways and Means Committee. So technically, from a legislative standpoint, the bill stays alive. There are certain deadlines by which bills have to move in progress. But because it was referred to Senate Ways and Means, it will be alive until the next year if there's no action on it this year. And then last, Senate Bill 256, that is known as a back to work bill. And that would eliminate most remote work for employees of state agencies, though the bill does include some ways for employers to grant or request exemptions, such as if the space is physically limited and it would cost a significant amount of money to create more space for employees, or if there's a lack of physical space, so that'd be impractical. And so that is a bill that I believe has been heard by the legislature. I am unsure if that bill will make it through both chambers this year, but I do want to let you know that bill has been discussed by the legislature this year. Moving from legislative updates to some association updates. As we are the state agency that licenses the mental health professions and behavioral health professions, we do belong to several national associations. One of those is the Association of State and Provincial Psychology Boards, ASPPB. They are holding their mid-year meeting April 24th through 27th, and that'll be in Montreal this year. ASPPB does not only oversee state licensing boards, but also has Canadian provinces and territories. And so most of the time that group meets in the States, but this will be a special meeting in Montreal. So I'll be attending that meeting with board member David Stevens. And then I will also, at that mid-year meeting, I've asked to be a presenter on a couple different topics. So I'll be a presenter on the topic of customer service, and then also composite boards. I also want to give you an update. In January, I spoke to the board and I let you know about a request for support that I had made from you all back in the fall. There was a lot of discussion concerning the licensing examination for psychologists, both for the licensed psychologists and master's level psychologist professions. The board, ASPPB, that is the association that is also in charge of the licensing examination for psychologists. And they had made a decision as a board that they would require passage of a second test as of January 1st, 2026, for any state that wished to continue to use their licensing examination for psychologists or master's level psychologists. And that was not open for vote from different states, but a number of states were having difficulty implementing that change. And so we worked in combination with some other state representatives to support an effort made by Texas to put forward a bylaw revision that would allow states the opportunity to request or to decide for themselves that they wanted to add a second test, or if they just wanted to continue to require the original current test, the EPPP, rather than require the EPPP and the EPPP2. Ultimately, about a week before that annual meeting, the board of ASPPB changed their minds and decided not to require passage of both tests as of January 1st, 2026. But the path to get to that point was very rocky. And in my research, I found that the bylaws for ASPPB had not been updated in about 11 years. And they really didn't have a process by which representatives from states or provinces could bring items to the body to be decided by the body. There's a number of other issues that I think need attention. And we, as a state delegate, have the opportunity to request committees and to work on different things. And so I requested the board's support to move forward and request a committee so that we could have the bylaws reviewed and hopefully changed to allow this process to be much smoother in the future. And so I did want to let you know, in between that meeting and this meeting, ASPPB put out an announcement. They are forming a task force in terms of a bylaw revision task force. And they made that open to about 7 different individuals to serve on that task force. Most of the seats were already taken. They're having, I believe, the current president, past president, and president-elect are serving in 3 of those seats. And then there is 1 seat reserved for members who are board members of jurisdictions. But I did apply for one of the open 3 seats on that task force, and I'm happy to report that I was appointed to serve on that task force. So they intend to meet monthly, and I will go ahead and attend those meetings on behalf of our board and represent the state to the best of my ability and try to make some positive changes with that. And then I can report back to you the progress from it. In terms of another association update, the Association of Social Work Boards, ASWB, for the first time, they are holding something called an administrator workshop. They put out a lot of resources to help boards. And one thing that they had heard a request for was for a training specific to executive directors and administrators. And I always am looking for opportunities to improve my skills and do better at my work with the board. And so this is an opportunity that they made available, one person per jurisdiction. And so I applied to attend that, and I was approved. So I will be attending that April 3rd through 5th in Washington, D.C. Additionally, they will be holding the ASWB mid-year meeting, and that will be in Portland, Oregon. That'll be coming up May 1st through 3rd. So I'll be attending that meeting on behalf of the BSRB. And then just to give you an update in terms of my committee service for that association, I'm currently serving as a member of the Finance Committee, and that committee meets about every other month or so, usually for about an hour or so remotely. So. And then an update on the American Association of State Counseling Boards. So we held the annual meeting for AASCB in Myrtle Beach, South Carolina. I attended that meeting with board member Laura Shaughnessy. And I was a facilitator during one of the sessions, which dealt with the topic of collaboration. So I got a chance to work with people from different states and help them sort of envision a way to work with associations and other individuals in creative ways. I was also a co-facilitator for an end of the conference session, just to kind of collect feedback from different individuals. And overall, from the feedback that I heard was that annual meeting went very well. Some of the topics that were at that meeting included things like artificial intelligence and emerging technologies, supervision, and then collaboration between states, agencies, and different associations. So, I also wanted to let you know, I've been serving as treasurer for AASCB. I was asked last year to take over 1 year of a remaining term for the treasurer position. They asked if I would be willing to run to be elected to that position, and so I did put my name forward for that. I ran unopposed, and I'm happy to say that I was elected to that position just recently. So I will continue to serve as treasurer for that association. But one of the things that I've done with that is I've tried to learn a little bit more about their inner workings and their operations, and I've looked for ways that they could be efficient with their money. They do charge a relatively small amount of a fee to the state of Kansas and other individuals who are members every year, but they have a little bit of passive revenue. And so I've been looking at their investments and working with some of their staff to help them so that they can have good financial management of their financial situation. So I'll continue to serve as treasurer. That term starts July 1st of this year, and it should run for 2 more years. Because of my role as treasurer for that association, I was invited to take place in a counseling leadership coalition that met in Atlanta, Georgia on February 27th and 28th. It was a funded opportunity, like I said, due to my position as treasurer for AASCB, and I was part of a large group of individuals, which included associations of counselors, regulatory boards, educators, and other individuals in the field. And the purpose was to have these different groups come together for conversation on the recent federal changes, and to hope that this group could continue to meet and use each other as a resource so that we can all work together productively. And then last update on associations, there is a meeting that took place, I believe, for the first time last year, where there was a regulatory board meeting for behavior analyst licensing boards. And I was able to attend that last year with board member Linda Heitzman Powell. They are holding that again this year, so I'll be attending that with Linda March 27th and 28th in Dallas, Texas, and then staying for the remainder of the conference with the Association of Professional Behavior Analysts in the same location. So looking forward to that. In terms of some other updates, in your packet, you'll see an update from Jason Hess. He's the board's appointee to the Kansas Fights Addiction Grant Review Board. Additionally, in terms of the multi-state compact, Richard Nobles is the commissioner for Kansas for that compact. They will have a mid-year meeting in July and then an annual meeting later on this year. For the professional counseling multi-state compact, I was able to attend that meeting following the AASCB annual meeting with Laura Shaughnessy. And then for the multi-state compact for social work, I am the commissioner for Kansas and was able to attend that meeting February 4th through 5th in Lexington, Kentucky at the headquarters of the Council for State Governments. It was a very important meeting as we went item by item voting to finalize bylaws for the commission, elected leadership, and having preliminary discussions on the type of data system for the compact and how the compact will be funded and which entities will serve as ex officio members. And so to avoid overextending myself, I did not seek a leadership position with the commission, But there are about 25 states that are now part of the commission, and they need individuals to serve on committees. So I did volunteer to serve on either the rules or the finance committee, and then waiting to hear back if I was appointed to one or the other, or both potentially. I also want to let you all know about an update. Last year, I talked about a collaborative effort here in the state of Kansas between the BSRB, the Department for Aging and Disability Services, and also the Board of Regents to come together and seek a grant to work with and get support from the National Academy for State Health Policy, NASHP. We were awarded that 2-year grant, and we have worked together since that time to learn from other states and different things. I've had some really productive meetings with representatives from KDADS recently. Some of the focus has been on discussing our temporary licenses and our provisional licenses. They are, at KDADS, they're looking and studying what some states are able to get reimbursed for those different non-clinical permanent licenses. And so we've been having kind of a conversation to make sure they understand our license types fully. We've made efforts to try to help people be able to get out there and get into the field. What we've heard some concern about is the level of reimbursements for some of those individuals. So now we're trying to work with representatives inside the state to see if we can help in that process too. Most of this historically has been outside the jurisdiction of the BSRB, and it still is, but we have no opposition to that. And if we can be helpful in that regard, we want to have the best outcomes for the state one way or another. So happy to report back on it. The rest of my report is just sort of a summary. I don't want to take up a lot of time aside from the other updates that I've already talked about, but I do feel like as board members, I understand that you volunteer your time, but you're not here in the office every day. And so I want to give you an accurate picture of all the meetings we facilitate on behalf of the board, and then also the other things that we are moving back and forth to do to help out the BSRB and our licensees. So with that, I'll go ahead and end my report and see if there's any questions on anything that I talked about or any other topics.
Thank you, Dave. Questions, comments?
I have a question. If the legislature were to approve the return to work legislation, what kind of impact would that have on BSRB staff?
So right now, what we have currently is we have 2 staff members, both of our investigators, that are approved to work remotely 3 days per week, and then they work in the office 2 days per week. And to make that work, what we did is we moved them both to one office as a shared office. And it would not functionally work if they were there, given the space and the conversations they have. Given the nature of their work, a lot of their conversations with members of the public are actually better to have in a private environment, like at home. And so the legislation does give the ability to request exemptions for things like if it would be costly to create new space or if it'd be unreasonable. And I think both of those things would fit in terms of what we have for our investigators right now. So I would request a continuation of that. We have tried to be flexible with staff. From time to time, we have one clerical staff member who works remotely 1 day every couple weeks. And so it's possible we may not be able to continue that if the bill passes. We could make a request, but I'm not sure if it would be approved. We've also had some instances where staff members were ill, and some of them were coming back from, let's say, a surgical procedure. And so we've requested authorization from doctors that said this person is able to do certain work remotely as long as they have some assistance and they're not, lifting things beyond a certain weight limitation. And so in those instances, we would still want to have some flexibility to make sure we have smooth operations. But we don't, at the moment, really have a lot of remote work for staff members. The biggest one is for our investigators. Now, if they both would have to return, that would create some real problems. Temporarily, we were able to have a staff member set up here in the boardroom, but that's really not conducive to the work an investigator does. We've also used other areas of the office when we needed to, but thankfully, staff worked on other projects to move paper records, and now we have things in a relatively stable position. So hopefully we will not have to make significant changes. If that bill does happen, that would be my request to do that. If it would not be approved or there'd be an issue with it, we would need to think really creatively in terms of using other space. But we, as you can kind of see with our office, we're kind of limited.
Or move.
or look at moving, and moving is costly too. Right?
Thank you, Dave.
I just
Anyone else?
wanted to say one quick thing.
Sure.
To Dave, thank you so much and if I could say this on behalf of the folks who are on the Licensed Psychology Advisory Committee, for your participation in ASPPB's efforts uh, to augment the EPPP and take into consideration the EPPP2. I know that it is a lot of work, and I really appreciate you engaging in it.
Thank you, Richard. I appreciate that. It's interesting at these meetings, they talk about, who is ASPPB? And I think for some people, they view that as, well, it's the board. And some people view it as, well, that's the staff that does a lot of the work facilitating meetings. And I totally understand both, but they tell us all that we are all ASPPB, that every state and every province has a delegate. And so I think we have a responsibility with that in terms of making sure that association runs effectively. And that EPPP2 requirement was going to be very difficult. It was going to be very challenging, and the board was united, and that they did not want to have that be a requirement for master's level or licensed psychology. So I appreciate your words, and I am happy to take that and run with it. And I've had some past experience with bylaw committees, and so I hope this will be a smooth process. But if there is a little bit of friction, I'll still push forward. It's definitely worth it. Just want to make sure that we have a good process set up for not just addressing what recently happened, but future things going forward. So thank you for that.
Yeah, here. Any other comments? All right, hearing none, we'll move to staff reports.
I was just going to give you an update on Estella. They have made stories for all of the processes of every form we have that we use. And so someone from OITS has been creating the stories, and then I've been going back in and updating or changing language and making sure all the forms are there for them to link to. And so far, we're almost done with social work, and we finished addiction counseling and behavior analyst. So we're kind of going down the list of everything, and it's going well, but it is a lot. It'll be good though when it's done. That's what I keep telling myself.
Yeah, the only other note on this is that we did include the historic table of licensees, and that number does continue to grow. I think we're over 16,000 now. So happy to continue to see growth in the professions under the BSRB.
Very good. Questions or comments? Thank you, Leslie.
Mhm.
We'll move to complaint review committee report.
Okay, I'll go ahead and I'll take this report this time. Cindy and I had talked, and you do have the traditional information that Cindy puts together for you in your packet. It does show the disposition of cases reviewed by the complaint review committee. And you can see there, the complaint review committee did meet in February, and there were a number of different decisions and the outcome of those cases there. For those of you that are newer to the board, one of the other documents you see is the number of cases open by license type. The number of cases that are open has grown, and it is up to 241. You can see that, like I said, by license type. Also, a couple of years ago, there was a question that dealt with how do we make sense of these numbers on a profession basis, on a per person basis? Because some of these professions have more licensees. So when you look at the numbers, of course, there's going to be more statistics usually supporting a profession that has more licensees. So how do you kind of weigh which profession is receiving the most complaints and that kind of thing, or has the most open cases? And so that last column, RAV per licensees, what we do is we take the current number of permanent license, looking at the number of open cases, and then below the number of cases received. So that way you can see the number of complaints per profession equalized by the number of licensees for those professions. So the larger the number in that last column, the more frequent we're receiving complaints against those types of licensees. Now, it always needs to be said that there is a huge difference between complaints versus violations. And some professions or some roles are more prone for individuals to receive complaints. But that is some helpful information so that you can review that information there. In terms of the last page of the report, reports of alleged violation statistics for 2025. As you can see, when we started this year, the total number of cases was about 212. It is now up to about 240 cases. Most of them are from this current year, but there are a few that go back to the previous year and then a few beyond that. Some of those cases are mostly when you have a consent agreement order, some of those items may be sent out and then there may be ongoing discussions. There's also some unique circumstances at times where individuals might appeal a decision or potentially cases where there's just ongoing discussion and different proposals. And so that is some of the information there. At the last board meeting, there was also a request to try to quantify. I think in the past, what we have done is we've talked to the board a little bit about the length of time between when we receive a complaint versus when it gets to the CRC. And I think in general, the time frame that we shoot for there is for the majority of cases to make it to the CRC within about 90 days, maybe 120 days. And that varies, but we have numbers that we report every year, usually at the start of the fiscal year. I provide those numbers, but I think to capture the entire time frame, what we had a request to do in my interpretation was to look at when the report of alleged violations are received to when the case is closed. And so I met with Cindy and pulled some data and attempted to work on that in a way that would be helpful for the board. I wanted to kind of go over the process that I was looking at to see if this might be something helpful for you or if you'd like me to use a different approach. I looked at statistics from the last 6 months, and I looked at the number of cases that had been considered closed by our investigators. And then I looked at the date that the RAV was received, and then the date of closure, and then took all of those cases from about the last 6 months and did an average in terms of the length of time. When you include all of those cases, there's about 60 or so for the last 6 months. If you include them all, the average length of time from beginning of complaint to when everything is finalized was about, I think it was about 10 months. Now, I also did 2 more metrics. I looked at the top 80% of cases, and then I looked at the top 51% of cases, because there were a couple of unique situations which were outliers when you look at the data. There were a couple of situations to where a case was pulled open to ensure we had jurisdiction. This case is now posted, so I can talk about it, but there was a situation to where there was an emergency suspension, and it was followed up with license revocation. But that entire process took years. So that kind of throws the numbers off a little bit. When you evaluate for the top 80% and the top 50%, what you're really looking at for most of them is a time period that is closer to about 100 days on average. And so that is kind of what we're looking at in terms of the majority of cases from beginning of RAV to close. That is what the average length of time is. Now, there is still going to be some variation there, because that does include some cases that were received, reviewed, and then dismissed. But it also includes some to where we received it, and an order was written, there was back and forth with the person, and so it wasn't considered closed until we actually had that all wrapped up. So those are the preliminary numbers, and I can continue to dig deeper into those. I can also go further back in time with more time, if that would be something helpful. Potentially, I could look at the last, this current fiscal year from July 1st of this year through, the current date at the next meeting. But I did want to take a stab at an approach and then pull some of that data and then kind of let you, I wanted to have the board's discussion to see if this is something that would be helpful for you, or if you'd like me to take a different angle in terms of summarizing some of that information.
Thank you, Dave. Comments, questions?
thank you for taking the time to put that together. I think we've been trying to kind of figure out what this process is looking like. So, the data, in my mind, I'm not sure we need to go back at all, but I think moving forward, it's a great opportunity for us to look at, is anything shifting? Is it changing? Perhaps as we see cases increase, how many are we really dismissing within a time frame? I mean, there could be some things maybe that would be meaningful in that, but I really appreciate you looking at this because I'm sure it wasn't an easy data mine to put together those numbers.
It's kind of interesting when we talk about, and I'm sure our investigators would agree with this. We don't provide legal advice, and sometimes when people give us hypotheticals, we can't give them an answer because the facts are different in every situation. And in looking at those list of cases, I wanted to look at the outliers, in my opinion, or the ones that were the extremes, to see what that situation was. And they each have a reasonable justification for why they were that way, but they are still part of the cases that were part of that. So I'll just continue to work through those numbers and maybe make this a consistent thing to report on at the meetings. And I'll maybe talk to Cindy and see if she can include something like this in the report. And I will also try to look to see, a couple of years back, there was some data from some similar agencies like the Board of Nursing and Board of Healing Arts, and they had some statistics for the length of time their investigations run. It's not exactly apples to apples, but it may be apples to oranges. Some of those other agencies, they don't include everything as part of their investigation. They may accept things, review them, and then if they determine there should be an investigation, at that point, the clock starts. For us, we start it the day that something comes into our office. And so there's pros and cons with both approach. But yeah, I can try to pull some of those other numbers and at least give you some perspective so you can see our totals compared to some of their totals as well.
Thank you.
Cindy, anything else? Okay. Any other questions or comments from the group? All right, we'll move on to professions reports and start with licensed psychology.
So good morning, all. Licensed Psychology met on the 25th of February at 6 p.m., where we continued our discussion on artificial intelligence and how to use artificial intelligence within therapeutic and assessment spaces. We also had a discussion regarding possible changes in the postdoctoral requirement with respect to the number of hours that could be counted towards said requirement. So if previously accumulated hours that were done in the doctoral program, if those could be used to be counted towards supervised hours. We also had a discussion regarding the revision of the American Psychological Association's ethics code, and we encouraged members to go to the APA's website so as to comment on the proposed changes. And I think open comments close later on this month. We also had a discussion about potential future topics for the committee, and those include matters regarding being supervised by other professions, supervising other professionals outside of psychology, as well as the possibility of having a discussion regarding monitoring prescription privileges for psychologists. And we also completed our training for the year, and our next meeting is going to be on April 8th at 6 p.m.
Thank you, Richard. Social work?
Yes, good morning. The Social Work Advisory Board met on February 25th, and we completed our annual training, which we had begun the previous meeting. We also reviewed 3 reports that were put out by the Association of Social Work Boards that were intended to drill down to some of the reasons perhaps for the discrepancies in pass rates on the exam. And that was very helpful. And we also noted that our revision or our of the social work supervision manual is under review with our legal counsel to make sure that everything's correct there before we implement that. And our next meeting will be on Tuesday, April 8th.
Thank you, Cynthia. Professional counseling.
Good morning, everyone. The Professional Counseling Advisory Committee met on February 19th. Some of the topics were, we completed our annual training, which we were really glad to get that done. We had a review from the annual meeting, AASCB meeting that David Fye covered in his executive director report today. Let me go back down here to my notes, I'm sorry. We had a great visit from the executive director of the Multi-State Compact, Greg Searles. He spent time with us and just answered questions from the advisory committee, which was terrific. He talked about the anticipated implementation date for the compact and talked about, some of the challenges that have made it, the rollout take a little longer. New business, we talked about possible topics for 2025, and our next meeting will be on Tuesday, April 1st. Thank you.
Thank you, Laura. Master's level psychology, we met on February 7th. We had a presentation by Dr. Brooke Mann from Fort Hays State University on remote education and training on psychological testing. We finished up our annual training for advisory committee members, continued discussion on educational requirements and regulation of artificial intelligence. Our next meeting will be April 2nd at 1 p.m. Marriage and family therapy?
Yes, thank you. We actually did not meet since our last board meeting. We didn't have a robust enough agenda, so we postponed that meeting. We will meet again as regularly scheduled in April 11th. I would say that in the meantime, though, we have sent out surveys, so hopefully we'll have some of those survey results to review at the next meeting.
Thank you, Mary. Addiction counseling?
Good morning, everyone. The Addiction Counselor Advisory Committee met a week ago on Monday, March 3rd. We are looking forward to reviewing at our next meeting the results of the survey that was sent out statewide to all addiction counselors. We had a meaningful discussion on the use of artificial intelligence in clinical practice, and we also had a conversation about the possibility of changing some of the regulations on making up practicum hours if someone makes an application for licensure and they don't meet the practicum hour requirement when they graduated from their program. We meet quarterly. Our next meeting will be in June, and we are working on finalizing a date.
Thank you, Jill. Behavior analysis?
Yep. We, at our last meeting, good morning, everyone. We completed the entire training because we hadn't gotten to it the previous meeting. So that took up the majority of what it is that we were doing. Following the training, we had a continued discussion on artificial intelligence and adding a description of the profession to the board. We will start to do that at our next meeting. We tabled that. Under new business, we talked about some of the potential changes at the federal level to some of our, the ability of people to access services with the potential for a reduction in access to telehealth. And, just wondered what we discussed what our role would be in helping to inform the public or inform policy, how that would work. Reminded everybody that there is the regulation regarding the number of people together that would constitute a meeting of the board, so that as we're discussing some of these changes outside of our actual advisory committee meeting, to make sure that we stay below that threshold. And in 2025, we want to continue talking about AI and some of these other changes that could potentially affect access to services. So our next committee meeting will be held on Friday, April 18th at 1 o'clock via Zoom.
Thank you, Linda. Any questions for the chairs of any of the committees? All right, seeing none, we're now scheduled for a 10-minute break. So we'll be back at 11:10.
vision has changed and. Computer glasses and that. Never get up close. Yeah. No, when you have to start pushing it, right?
Back. All right, welcome back, everyone. We'll move to old business. Discussion on proposed changes to regulations. Start with unprofessional conduct.
Okay, well, I want to make sure that everybody saw right before the board meeting today, we did send one additional document out, and this has been quite the endeavor. You may recall for the last couple of years, we have been having advisory committees review and do a very thorough discussion on the unprofessional conduct regulations for each profession. There's a separate one for all 7 professions, and each advisory committee reviewed, made recommendations on changes. Those were all submitted back to the board. Because of how different the changes recommended were, the board went ahead and took the combined packet and sent that back out to the advisory committees so advisory committees could see what other committees had recommended. And then there was an opportunity for further recommended changes. And so those were all combined and then provided to the board. And at the last board meeting, we provided a fairly lengthy document that was about, I want to say 60 pages or so, which was a copy of the unprofessional conduct regulations for all 7 professions so that you could review and take a look at all the changes. But I realize that that is a very difficult thing to do because of how many different professions and how many changes there are. And also a lot of the professions have similar topics and language. And so one thing that we attempted to do since the last meeting and this meeting, and we are very close to having finalized, is a crosswalk where we have gone through all of the 7 unprofessional conduct regulations for the professions, and we have tried to identify each of the different items and basically highlight the items of difference and also let you see side by side the language that is used for each of the unprofessional conduct regulations. So that crosswalk I talked about, it should be considered a draft. There's a handful of items that are not included here. We attempted to go ahead and include all items. Most of them we were able to link up and have similar items by profession. Psychology was structured the most different between all the professions. So there's a handful of psychology items that we will probably need to include in another draft for you. But we thought this would be something helpful to provide. And if the board wanted to take a little bit of time today, we could walk through a few of these items. There is also a question of, so the advisory committees review and make recommendations, and the role of the advisory committees is to support the work of the board. And so the board really is the body that makes the decisions in terms of what should be in the regulations and what shouldn't be in the regulations. And so you have a choice as a board. You could have similar language that is uniform between the professions, or if there are unique aspects based on scope of practice and other factors, it would be permissible to have language that is different for one profession versus another or compared to another. But there have been a number of individuals in our office who've worked on this. I've mentioned in a few meetings that Emma is a member of our staff who's taken on some assistant roles for me. And so she has helped me with this crosswalk, and I thought it'd be helpful for her to attend, so she's present. And so Emma, if you have thoughts on different items, feel free to share. I also asked Cindy to log in. And so Cindy is in attendance as well. And also Joan, our 2 investigators for the board. And so I thought we can approach this however the board would like to do it. But I could go ahead and share my screen and we can go through a few of the items. I realize that there are a lot of items on here, but if it would be helpful, we could start to discuss some of these items together. And then if there's consensus, we could go ahead and maybe bring that back for the next board meeting and go ahead and maybe take 2 shots at it, do what we can today, and then bring it back and maybe finalize it the next meeting, if that seems like it's okay with everybody.
Yeah, I think so.
Okay. Well, I will go ahead and share my screen here. I'm going to go ahead and pull up a copy of the crosswalk so that we can all see those items together. There are also some items that I have marked appendix, certain letters. There were certain items that were just so lengthy in terms of the wording that I thought it might be helpful to include those in a separate sheet. So that way you could view the language for those items separate versus having 7 small columns right next to each other and have a difficult time seeing the language. So let me make my screen as big as I can while also capturing the text of these different items. Maybe I'll try about 75 or 80% there. Okay, so we'll go ahead and start with the top item. So one thing I wanted to note for everyone, and by the way, the view, can you all on Zoom, can you see my screen in terms of the, okay, let me go ahead and share my screen here so that you can see the crosswalk. Okay, you should be able to see the crosswalk now. Can you see that on your screen?
Yes.
Yes.
Okay, great. Perfect. Okay, so what you see here, and like I mentioned, this is a draft, so we will clean this up a little bit more, but at the top, you will see 8 different columns. The first is intended to reflect the different items. The columns, aside from the first on the left, has the unprofessional conduct main regulation for each of the 7 professions. So if you can see there, addiction counseling is KAR 102-7-11, behavior analysis is KAR 102-8-11, etc. One item for you to review and consider is what language you would like to have in the description of who the unprofessional conduct regulation applies to. For example, the current language for the addiction counseling profession says that each of the following acts shall be considered unprofessional conduct for a licensed addiction counselor, a licensed clinical addiction counselor, or an applicant for an addiction counselor license or a clinical addiction counselor license. This was an item that was discussed by that advisory committee. And so the language that they recommended removing from the regulation is struck, and that is red. And the new language that they are proposing is blue. So as you move through this, if the language is neither red nor blue, it's just the existing language as it currently stands. If there were recommended changes, then you can see those accordingly. So as you look across the sheet, some of these regulations try to be very specific in terms of applicants or licensees. But what I would also reference for the board, something to consider, is that we now have individuals who hold out-of-state permits in these areas. We also have individuals that either are able already or will be able to practice under a privilege to practice because of the multi-state compacts. And so we do have authority based on the language in those compacts over those individuals, but this language here doesn't really specify that for most of the professions. Now you could look at the language for licensed psychologists where it says each of the following shall be considered unprofessional conduct. And it doesn't specifically say applicants, licensees, but it may be helpful to add some clarifying language that it would apply to not only licensees, but also applicants for the board. You could also say individuals who are authorized to practice this profession or something like that. So something for you to consider on that item. In terms of the first item, item A, that is one that has an appendices. So I'll go ahead and move to the language for that item. And happy to share this.
I was just gonna point out that the LMLP regulation says it only includes an applicant for master's level psychology, not licensed clinical psychotherapist. I just wanted that in the notes so I would remember later when we're.
That is good. Okay. Well, thank you. This is an example of the appendices that I was talking about, when there's items that have a little bit more text or language, and trying to fit this into a narrow column and make sure that you could see the items of difference. I thought it may be helpful here. Similarly, if there's red language that has a strike through, that is language that has been recommended to be removed. If it's blue, it's a new item. This is for, I think, most of the professions, if not all of them, the very first item, or at least the second item. And it says, except when the information has been obtained in the context of confidentiality, failure to notify the board within a reasonable period of time that the licensee or applicant or any other person regulated by the board or applying for licensure or registration has met these conditions. And when you look across the different professions and the language for this item, 3 of the items are very similar in terms of the language. The first item has had a professional license granted by any jurisdiction or limited condition, restricted, et cetera, maybe during investigatory or disciplinary proceedings. 2 has been subject to any other disciplinary action by a credentialing board, professional association, professional organization. Or 3 has been demoted, terminated, suspended, reassigned, or asked to resign from employment, or has resigned from employment because of some form of misfeasance, malfeasance, and nonfeasance. The language might be slightly different for those 3 items, but it is pretty consistent profession to profession. The language that I highlighted here for emphasis is that some of these professions say also it would be a violation to fail to report if someone has been substantiated of abuse against a child, an adult, or resident of a care facility, has practiced the licensee's profession in violation of the laws or regulations that regulate the profession, or has been convicted of a crime. You will see a little bit different language for some of the professions, as it talks about, some of them also make reference to crimes. At least one profession makes reference to it being a felony. If you see here, the social work regulation. So not all those items are included for every profession. Also, some of them say that you should report if you were convicted of a crime or a felony. There's also some language that, as far as who this all should apply to. Should it apply to any person regulated by the board, or should it apply to oneself? And that language, as far as that goes, is also different when looking at each of these regulations. So that is something where the board could have uniformity between the professions, or the board could allow that to continue to be different profession by profession.
Hey, Dave, can I
Yes.
interject?
Yes.
One thing that I just wanted to point out is it's the verbiage, failing to notify the board within a reasonable period of time. And I don't know if that needs to be discussed or not. Where it becomes, some people have interpreted this to mean A through E is not the problem. It's failing to notify the board within a reasonable period of time is the problem. So you've got somebody who's been, where we see it is like they've been demoted, terminated, suspended, or reassigned, or asked to resign. Well, they tell us within a reasonable period of time. So then what? I mean, do you follow me? I mean, it's questionable. Is the problem, oh, you've been terminated? Okay, but you told us in a reasonable period of time. So, I mean, I'm just pointing that out. That sometimes it's problematic for us when we're trying to figure out reasonable period of time. If they don't tell us in a reasonable period of time, is that the problem, or is it these things that are listed below that become the unprofessional conduct? I'm just interjecting that.
Yeah, and thank you for framing that, Joan. Some of you who may not have worked with Joan on the complaint review committee, you may have more familiar with Cindy as one of the investigators for the board, but Joan is also an investigator for the board, and she does bring up some good points here. This item is really specific to failing to notify the board about these things. So these things do not amount to an unprofessional conduct violation in and of themselves. The real issue here is failing to notify the board if any of these, within a reasonable period of time, if any of these conditions has occurred. And so it's possible that if someone notifies the board about these things, within a reasonable period of time, the board looks into it and there's no violation there. But potentially it could be a violation because of a lack of notification of the board, so. So I wanted to share this with you all. I'll go ahead and make this and the other appendices available so you can take a look at them, and they will definitely be in the packet for the next board meeting. But I just wanted to share this as an example of some language that is very similar, but also significant in that it is different when you're talking about some of these things and what some of these professions have and who it applies to, whether it's a felony or whether it's a crime, and different things like that. I'll go back and share my screen with the rubric again. We can go through a few more of the different items here. Okay, you can see my screen? Okay. If you can't see my screen, please let me know. Under the rubric, you will also see that there was an effort made if you are using the packet for all the unprofessional conduct regulations as a guide. What we attempted to do first is we attempted to go through the first unprofessional conduct regulation and then go item by item. So going down the page, you'll see A, B, C, D, E, F, G for all the different items under addiction counseling. And then if there was something that we identified as a likely similar item across the professions, we tried to include that language while also noting which section it comes from. So for that number 2 item, addiction counseling would have it be a violation to knowingly allow another person to use one's license, which is the same language for behavior analysis. Also psychology. For bachelor's level psychology, it includes or registration. We don't register individuals anymore, so.
Yeah, I wondered about, that's old language, right?
It is.
Is that true of, it's under marriage and family therapists and counselors as well?
That's right. So that would be a good example of something that we could do very easily just to make the language sync up and fit what we currently are doing. Is that something that the board would be in favor of in terms of removing or registration for that item?
Yes.
Sounds like we don't need it anymore.
Yeah, it makes sense.
Sounds like there's consensus on that item.
Is there a scenario, and I mean, this is the what if, is there a scenario in which another group would come before the BSRB as registrants versus license, or would we seek to avoid that kind of thing in the future?
So the only instance I can think of would be, I'll say, quick answer is no, I don't think so. But the analysis that I was doing in my head real quick, in Canada, I believe they are still considered registrants versus licensees. And potentially under a multi-state compact, individuals could be using some other home state license per se to get the privilege to practice through the compact and be able to practice in another state. The issue with the multi-state compacts, though, is that they are state specific, so it doesn't include anybody from outside the United States. And the United States, everyone I believe is licensed, at least for most of the professions. Now, as it comes to some of the professions, potentially like addiction counseling, there may be registrants versus licensees in that area. Leslie, are you familiar with anything like that?
There are, for addiction counseling in different states, they have certification registrations, different things. So does social work, actually. Some of them are still certified social workers.
Okay. There's not currently language for multi-state compact for addiction counseling, but maybe it would be helpful to leave it in there for that purpose. If it's not going to harm anything to include it, maybe it would be helpful to have it be the other way.
Okay.
Is there anyone opposed, thinking that, potentially we could get a scenario where there might be somebody who gets an authorization to practice based on their registration in their home state?
I I was gonna say, I think if you're gonna use registration, you should include all of them. Like reciprocity says registration, license, certification, or credential or something like that,
Okay,
if that's why you're using it.
okay. Maybe we can write up a few terms that we can put in there next to it, given how these professions are evolving in terms of the multi-state compacts.
Would it make sense to, I mean, and I don't know if this is a adding to something up like who it applies to, but make it, instead of having to change verbiage like that in 1, 2, 3, 4, you know what I mean? Like have it up at the top being who does this apply to, and then just have it in one place so that it's applicable all the way down.
It might be. How about if we take a look and we'll see if we can make that something that we can standardize for some of the professions.
Right, right. I mean, that's what I mean. I'm saying rather than like number 2, number 3, number 4, and trying to parse out, who this applies to, just kind of have it up at the top that here's your list of who it applies to, and all these things down below, could be you.
Mhm. Okay, well, we'll put a pin in if there are descriptions of licenses versus registrations or certifications, and we'll come back and give you some feedback in terms of if that should be broader, if we can handle it, like Joan was saying, with something above in terms of who it would apply to. Because potentially we would also want to include permits, given that we do the out-of-state permits, then that should be something that would be handled as well.
So the question I have is, does the first row get to that, where it talks about this is who this applies to? If you were to maybe broaden that to include registration, certification.
Mhm. Yeah, I think it's so. It would depend how broad of language we wanted to use to replace license or registration. And I think, if we replace that with an authorization to practice, potentially if you make it a bit more broad or a bit more vague, you might have people who might be confused that it may not apply to their license, or I don't know. But maybe there's a way to clean that up at the top. Let's put a pin in this one, and then we'll see if we can kind of bring back some options for you all.
It does seem like saying anyone authorized to practice this profession by the board would cover all of those categories and any future ones that the legislature comes up with.
Yeah, I was trying to think if there might be a term like credentials, but I know for insurance panels, credentials means something different than just having a broad term credentials. And so
That's what I was thinking of credential, because it's not a specific type, it's just a.
right. Okay. Well, on the row that starts with the purple number 3, starts off in the addiction counseling as item C. Impersonating another person holding a license or registration issued by this or another board. Very similar language you're seeing across. Just it seems like some of those professions include license or registration. But for the most part, that is similar.
We've actually had a problem with them using board. There's actually been a problem with jurisdiction with the word board with that.
So Cindy, what would you have any
With
recommended
board or
term?
agency? So this is an example. If they had an old KDAD certification, if it says by a board, if they had a license or registration, if before they became an LAC, that we decided at one time that didn't fall under that because it wasn't a board, it was a state agency.
Well,
It was
and Cindy, yeah, you bring up a good point, because there are some. So in Kansas, we have what we call a composite board, where it's professionals and members with different professions. In some states, you have standalone boards, and then in some others, you have what's called an umbrella. And so you might have an umbrella agency. that oversees different boards, and so they make recommendations, but it's that umbrella, sometimes a department potentially instead of a board, so.
Yeah, so it was a department, and so that was the decision made at that time about what is a board? You know, so if KDAD's issued a certification, and is KDAD's a board, or actually maybe that was even SRS at that time, that if they issued a certification, was that a board? Or if you know, KDH&E, if that person at that time had a license through, you know, something like that, a state agency certification. And so what does
Yeah,
that mean?
KDAD still credentials peer mentors. for the
Right, so
state.
something like that, you know, or if, yeah, and so if they had a if they had a facility license through KDADS, like right now currently, if an LAC had a facility license through KDADS, would that regulations apply to that? And so perhaps, depending on how you interpreted that, perhaps not,
Okay,
because it says
Okay.
board.
right. Maybe we can come up with a broader term than board.
Well, right
Or-
next to it says board or another agency,
Mhm.
just a thought,
Under behavior analysis.
yeah.
And I think that's pertinent to behavior analysts because there's a CCTS certification, clinical and consultative therapeutic services, that people with master's degrees can get in the state of Kansas that allows them to provide oversight, assessment, and services to teams that are working with kids with autism in home and community-based settings. And a lot of behavior analysts who are in their field practicum placement get that CCTS certification and then go on to become behavior analysts. At which point then they would become an LBA. Right? So that is still issued by, it's not KDHE, it's KDADS, I believe.
Okay, well, good comments. I think we can, is there any opposition for broadening that terminology for the other professions? Okay. I think that's a change that we can make and bring back for you to take a look at. Under number 4, it starts with a D for addiction counseling. To be a violation to have been convicted of a crime resulting or relating to one's professional practice of addiction counseling. And that language is pretty standardized. When you look across the professions, I don't see a lot of difference there. It just highlights, you know, the different professions. Potentially professional counseling, you could get away from the 2 specific license types that are cited and just say professional counseling, but that's really the only thing that jumps out to me.
Yeah, that broader I like because it just, you know, what we were talking about earlier, any new license types that get your, you know, designations would then be covered. Yeah.
And then under line 5 with E, furthering the licensure application of another person who is known or reasonably believed to be unqualified with respect to character, education, or other relevant eligibility requirements. And I think we didn't see language necessarily that lined up from the behavior analyst profession. So that is something that could be a topic of discussion, if that would be suitable to go ahead and add similar language for that profession. For the others, there is similar language. Looks like for most of the professions, when it comes to character, education, or other relevant eligibility requirements.
I'm sorry, David, what does that mean?
Well, I
Does
suppose
that mean when you recommend someone and you know they're not qualified.
Mm-hmm.
So all of those ones that we talk about sometimes, that some people recommend them and some people don't.
Yeah, I think it's knowingly recommending someone that you realize is not qualified under those conditions, but you're doing it anyway. So you're endorsing someone regardless.
So would this potentially apply to a couple of incidences we've had recently where someone recommends for licensure, but then gives some indication that the person has issues that makes them not qualified? Would they be subject
I
to?
don't think it's, I think it would be if you didn't give your reservation. You can still recommend somebody and you're giving your reservation, but if you say, I have absolutely no problem with this applicant, and you know something about them that really would make them unqualified, that's where standard would apply.
I can see that, and this might not be the place to discuss this, but how would you even prove that? I mean, how would that even come to our attention? That would it then be somebody filing a complaint? So I'm just going to use me. I recommend somebody to become a behavior analyst, fully knowing that they're unscrupulous, right? And so then there would have to be this other party out there that makes files a complaint against me for recommending that person. Is that how this would play out?
I believe so.
Yeah.
Yeah, or it could be, Linda, that the board or the reviewing panel makes a determination that clearly this person isn't qualified. They falsified their education or something along the lines, and the recommender was aware of it. I mean, it would need to be, facts along those lines. If you get in a situation where, reasonable minds can differ as to whether or not somebody's qualified or merits the public trust, I think you have trouble proving, to your point, you have trouble proving that violation.
Right. So what I would say is, if that is something that 6 out of the 7 professions think is important to have in their unprofessional conduct code, shouldn't we take this back to the advisory committee and say, this is something the other professionals have deemed to be important and recommend including it in our unprofessional conduct?
Yeah, there's a couple of different pathways here. The advisory committees, they work to assist the work of the board. And
Okay.
so, and they've provided input on these items previously, but since this is an item that really wasn't in that set, it's kind of hard for them to, unless they just noticed that it was not in theirs compared to everyone else's. But so the board could go ahead and vote if you think it's reasonable. Just as board members, you could make that determination. But since we did talk about there's probably going to be another opportunity for the board to continue reviewing these at the next board meeting, there would be an advisory committee meeting in between. So you could bring this back to the advisory committee and talk to them about it.
Also looks like the reasonably believed to be language is in all of them but social.
That is true. There is language, like you said, Dave, that it says another person who is known or reasonably believed to be unqualified. But in social work profession, it says who is known to be unqualified with respect to character, etc. So the reasonably believed is not present in the social work regulation. So that could also be, if you wanted uniformity, that could be something to weigh in on as well.
Right.
Reasonably believed to be is a much harder standard to actually prove.
Mm-hmm.
Right.
Well,
Yeah, it makes me wonder a little bit, what exactly we're getting at with that standard, because you could read it as, known, indicating that we're trying to, nip fraud in the bud. in the recommendation. And so, the standard that you would look at with fraud would be it's either known or it's should have known in that situation. And it's a reckless disregard of the truth, reasonably believed is arguably inconsistent with the standard. I suppose it depends on ultimately what standard you're looking at.
Like a reasonable person should have known.
Yeah. Well, yeah. I mean, that's a little bit different though than what you typically look at with fraud, which I think is the intent of
Licensure.
Yeah.
I think this would be an important thing for each of the professions to have some guidance for people who are supervising folks for their clinical license as to if it's a reasonable person should have known, what duty does a supervisor have to research or, ferret out whether there's anything that should prevent a person from being licensed other than your knowledge of their supervision and their performance. Like, do we have a duty to background check them in some way and make sure they don't have some kind of violation to avoid behaving unprofessionally ourselves as supervisors?
I agree with you, Cynthia. The one thing that I can think with that though is that we already have a difficult time finding people to supervise. And if we put the onus of responsibility on each of these supervisors to do thorough background checks before I think we're going to lose supervisors.
Oh, I agree. I just think that this could open up the possibility of people thinking that they need to do that.
Right.
But yeah, we've got more than enough difficulty having enough people willing to do the supervision in the first place.
Okay, well, this is definitely an item for further discussion and maybe something for the different advisory committees that have some different language to discuss in terms of recommendations. On the next page, we look at item 6. Item 6 says, knowingly aiding or abetting an individual who is not credentialed by the board to represent that individual as a person who was or is credentialed by the board. The language here is fairly similar. There were a couple of recommendations by the Psychology Advisory Committee and then Master's Level Psychology Advisory Committee concerning that term credentialed. And I do think it's probably a good idea to get away from that term just because of how it's usually linked to reimbursements, perhaps. But there could be other terminology that's very similar that might have a broader application. So. Number 7, failing to recognize, seek intervention, and otherwise appropriately respond when one's own personal problems, psychological distress, or mental health difficulties interfere with negatively impact professional judgment, professional performance, functioning of the ability to act in the client's best interest. It appears that this language is similar, at least when you're looking across the different professions and what language they're using. Does anybody see any item of difference here that you would want to highlight for a possible modification?
I wonder if instead of mental health, it should say behavioral health. Kind of a more inclusive term.
Yeah, like that's
Yeah. Because if we said, either mental or behavioral health, because somebody may argue that if I'm taking substances, some kind of substance that might impact my judgment, that's not really a mental health, that's a behavioral health. I mean, I'm just thinking of how people could argue against that if somebody was referred to the board for this particular unethical or unprofessional line.
Any other
I-
thoughts on?
I was
go
going
ahead.
to, I also wanted to point out, I just noted that psychology inserts make arrangements for the care of clients,
Ooh,
and none of the other ones do. And I don't know, I just kind of like that.
You are correct. Thank you, Joan.
Uh-huh.
Would definitely be a part of your responsibility if you're unable to care for your clients to make appropriate arrangements
Yeah,
for
I mean,
them.
I kind of liked how it pulled that out. I mean, I mean, there's a lot going on in this statement, don't get me wrong, but I liked how that specifically pulled that out.
We just had an application from someone whose supervisors claimed that they had been impaired and not able to care for their clients and did not make appropriate arrangements. So that's a practical example.
Well, good discussion on that item. Let's go ahead and skip the next item that has the appendix there, and we can just continue with this sheet here. Number 9, offering to perform or performing services clearly inconsistent or incommensurate with one's training, education, or experience, or with accepted professional standards. This language is somewhat similar. For psychology, it says professional services that are inconsistent with the licensee's education, training, or experience. It doesn't really mention accepted professional standards.
I would welcome a change in that direction and to add offering to perform, so just not performing. Across the other professions, it's stated offering to perform. I would also welcome a change.
We have some issues when we look at establishing jurisdiction. But when we get a complaint in, we read the complaint and then we see what we might have jurisdiction and we add these to them with professional counseling, how different it is. Although it might have been a good idea to look at specifically what professional counseling does, is it's so specific at trying to match what the actions are based on how professional counseling is read. And so professional services, although might seem vague, when you match that up with the very specific things of like these specific assessments, consultations, sometimes the actions don't quite match up. And we have trouble with that wording, where it's clear that someone has done something inappropriate. It would work for every single other license, but not for professional counseling because of the way that it's written. Is that a good way do you agree with that, Joan?
Yeah, Dave and I had actually, so Dave just told me on Friday, oh, we're going to have these discussions on the unprofessional conduct regulations. Can you think of anything? And that is the first one that came to mind, was unprofessional counseling. And I was just like, oh yeah, that could be changed.
Do we need to take? Oh, go ahead.
Sorry.
No, just do we need to take that back to our advisory committee, or do we need to? I really appreciate the feedback of our evaluators because you guys
Yeah.
deal with this all the time.
Yeah,
Do you
that's
have
definitely
language?
something.
Yeah, it's where real world meets up with these regulations. And
Right.
Yeah. Just generically, David already said it, is that we would like things consistently unless there's a reason for your practice. If there's a specific reason, like it is this way because this is what we do. So we understand if there's a reason why it's written that way, but we have come up with cases and we're like, so maybe we don't understand why it was written that way, but we just like performing an offering. That's another thing that we bring up is why doesn't it say offering? But then Richard already addressed that, but that performing services seemed appropriate to us, offering.
Mhm.
And with psychology, I didn't make this explicit, but the piece about accepted professional standards, I would also welcome
Yeah.
that change.
For
And for
psychology,
those of you that are on the complaint review committee, this is used a lot. This is probably one of the allegations or violations that gets matched up a lot. So if you want to look at this and see if there's something that you don't see or would like to change, we use the complaint review committee uses this a lot.
Having said that, Cindy, David, I think this would be an important one to take back to the advisory committees. Because some of the members of the advisory committee might see things that their representation on the board doesn't see.
yeah, I think there's definitely be time between this meeting and the next meeting for sure to have some of these discussions. So we could definitely put it on
Yeah.
the agendas. There's a couple things I wanted to highlight for you as well. The standard for psychology is missing the word clearly. It just talks about professional services that are inconsistent with the licensee's education, training, and experience, not clearly inconsistent. Probably has to do with the standard for being met there. And then for the master's level psychology, there is actually some additional language at the bottom of their section, which says including but not limited to telehealth practice. And so I think they're wanting to put a spotlight on that as it relates to this topic. Under item 10, it would be unprofessional conduct to engage in any behavior that is abusive or demeaning to a client, student, or supervisee. Whereas some of the other language talks about treating a client, student, or supervisee in a cruel manner. And for professional counseling, they had a recommended change to replace the word cruel with unprofessional or unethical.
I also think removing treating, because in this context, you know, treating has a particular meaning versus engaging, and I prefer the abusive to cruel. I think that's better language.
So maybe use the word engaging versus treating.
I liked, I thought the language from the, I think it's the addiction professional.
Behavior that is abusive or demeaning to clients.
Or engaging in versus treating.
Engaging in.
I would change ours to what they have.
Can I interject here to maybe a conversation about in any of the regulations where there's a list like this, client, student, or supervisee, can we consider adding direct D? For example, if someone is under direction of, and part of the reason I add that is because way on down at number 35, I forget number 39, in one of the lists, it actually uses the word direction. And so, and I forget, it might be, I'm sorry, I didn't write it down, which profession included it, but somewhere along the line, those individuals who are under direction versus being under supervision, they get tacked into something. And I'm just wondering, would it be worth a conversation, or would it be worth considering when you have a list like this, also including direct Ds, which for those of you who may not be familiar, a person who's under direction is an individual who's not accruing hours toward clinical licensure. it's an LMSW who's not accruing hours toward clinical licensure. They have to be under direction because they're not independently clinically licensed. It's the LMLP who's not accruing hours. I'm just inserting that as maybe that might be something we want to consider, or maybe that's a conversation for a whole nother time.
Looks like it's in the LPCs already, so I mean, I'm
I
in
was
support of
thinking it
adding
was
that.
professional counseling. I neglected to write it down, but in my mind, I was thinking somewhere along the line, somebody in professional counseling has started inserting that, but it's certainly not consistent at all.
At one time, we were just going to call them all supervisees, and then that kind of got off track because people couldn't get their head around them. And so we're all going to be supervisees. We don't need to call them directees. And then I think we gave up on that.
Right.
Yeah.
But like I said, the problem being there actually is it is distinguished in certain places between supervision and direction. And it just might be helpful if it was just, I don't know, more clear.
Well, let's just do a few more of these, and then I know we have other items on the agenda for this meeting, but
Let's do 12.
I'm enjoying this opportunity to work directly with board members, and I think this discussion is really, really good. So,
David,
yes.
can I pop in for a second before we move on? Just coming back to Direct E. And so my mind goes to the staff that work with the clients that are overseen by BCBAs. And so because they're under the direction of, and so so here's the question. Does our unprofessional guidelines encompass everyone that we have contact with? So I'm going to say something that's really ludicrous. Does it, if I am short or abrupt with the cleaning staff that come in to clean my office because they failed to do their job correctly and they're under my direction, does that then open me up to an unprofessional complaint to the BSRB? So I think
being under direction is in the regulation. There's a definition for it. Wouldn't that tie into it? Yes, but I don't know that it is for behavior analysis because you guys don't have that. I mean,
right.
The other professions have it, so it would not be as, you can't provide direction for other professionals, and you don't have under direction in your statutes or regulations, so maybe it would be appropriate not to have it for yours.
Okay.
Yeah.
Well, and addiction counseling doesn't have under direction either.
They do now.
Oh, sorry, my bad. Sorry.
Also, I don't think that your conduct in supervising or directing your cleaning staff is in the capacity of your professional license.
Right.
That's in your
That's what
capacity as a renter or an owner of the space.
Yeah, that's what I was thinking too. But then I started thinking that sometimes we insert these terms and then perhaps an external audience's interpretation of that would broaden it too much so that became their interpretation of it, that at all times that
It's a good question, Linda. It's a lot of things that Joan and I spend time doing when we get complaints in, like with internal complaints, like when a former employee will file a complaint, and we do get these complaints where we have to figure out whether there's jurisdiction about a supervisee and a supervisor about how they interpreted that. I mean, it already says supervisor in there right now and supervisee, and we get that complaint and how it's interpreted right now. So it's a good question to think about, but we already have that question right now, how they're written with the word supervisee and with client. We have to interpret client all the time and what that means.
Right.
Okay. Well, I'm just gonna very quickly move to just maybe three more that I'd like you all as a board to think about between now and the next meeting. It's on the next page, item number 12. It says discriminating against any client, supervisee, or any client, directee, or supervisee on the basis of, and then there's a list of different items there. You have similar language under behavior analysis. I don't believe there is a comparable one in the regulation for psychology, at least not that identified on a first pass. The reason I wanted to bring this to you is because this is one of those that has very different language, profession by profession. And I know what influenced that most likely is because while our unprofessional conduct regulations differ from, let's say, an ethical code of an association, there's a lot of discussion where some of that influences the discussion because members sometimes are members of both the association and they're held to the unprofessional conduct standards. And so there's a logical perspective on that. In terms of, we want to have a standard that's going to be consistent and easy for people to understand, and something that as we have changes at the state level and the federal level, we want to make sure that we have some categories here that are defensible. And so one thing that I wanted to propose to you, or at least get your feedback on, is instead of having different language by profession, because like I can tell you, if we propose this and we put it out for public comment and we go in front of the Joint Committee on Rules and Regulations, they're going to ask us, there's so much similarity between these professions, why are these categories so different? What I would be curious if the board would be interested in supporting is, instead of having each of these topics listed, perhaps you could say it would be a violation to discriminate against any client, student, directee, or supervisee on the basis of membership in a protected class under federal or state law. And I know we don't usually tie the agency to a different entity, like let's say an association, because we don't have control over the standards they might set and the language they might use. But in this case, we are held to the standard of making sure that we do things under the law. And if those protected classes should change, we would need to make sure that we change accordingly with that. But there also would be a level of consistency. So I wanted to kind of bring that up for discussion and see if you had any initial thoughts on that. So I guess I'll just pause there and see if there's any initial thoughts on a proposal like that for an item number 12.
Is sexual orientation a protected class under federal law?
And I should have done some homework in looking to see what those items were under the list. I am unsure what's actually covered in those two different categories.
Last I was aware, Richard, it is with the current Supreme Court. I'm not thinking of a case which is addressed and maybe change that.
Mhm.
Okay, I got it. If someone wants to know. It is race, color, religion, sex, which includes their sexual orientation and pregnancy, national origin, and age, which is 40 or older, which is really scary to me. Disability or genetic information.
Mhm.
And that is from the Equal Opportunity Commission. And I know the state is different. And when you guys talk, I'll Google state, which might not come up.
So
And I think
David,
that's what, oh, sorry, go ahead, Cindy.
David, this is where social work ethics would be in conflict if we are only conducting ourselves unprofessionally, if we discriminate based on what is protected by federal or state law. In lawsuits against social workers, the code of ethics of NASW is what is typically used as the standard. And there are there are categories in what's listed here that are not protected classes now. But yet, as social workers, we would be ethically required to not discriminate against someone on the basis of those legally unprotected status.
That's helpful information. I appreciate you bringing that forward, Cynthia.
And if I'm recollecting correctly, psychology, we made a decision to include a clause like this. I know that it's not in, it's not enacted yet, but because there were things that were added in blue, I just wanted to make sure that what psychology had voted on is in fact going to go up for approval with the Office of Administration.
Yeah, I remember the same thing, Richard.
Yeah, and I would just throw in here, I think when we make recommendations about what things should be included, I think there's clearly conflict, I think, among most of the ethical standards and now what's law. So I'm not sure, how to reconcile that the right way. I just think we need to be very thoughtful about our language so that our language and somehow wouldn't be in violation of federal or state law, and also understanding that there are specific ethical standards which, may or may not have to evolve depending on how laws play out. But I just think it's a good conversation to be mindful of.
The protected classes in the state of Kansas, and we have the Kansas Human Rights Commission, are race, color, national origin, age, sex, and disability.
And the legislature lets us know that we are trying to go beyond what is protected in Kansas.
Two different things, right? One is what you're held to by your license, and then what you're held to by an ethical standard if you belong to a particular organization, that your profession,
Hmm.
the NASW, but if you don't belong to that group, could you still be held to that standard?
My understanding is that in lawsuits that have been filed against social workers, that the NASW Code of Ethics is the standard that is typically consulted. And you're right, if you're not a member, you're technically not you haven't technically pledged or said that you will be guided by those ethics. But those are the standards that are taught in schools of social work, and those are the standards that we're expected to abide by. And someone in those unprotected classes should have some recourse if we're living by those ethics, but there's nothing in the regulations that allows a client who's been discriminated against in one of those categories that isn't included. There should be some protection for them. I don't know where else we get. I mean, I think you can file a complaint with the NASW, but that doesn't really carry the most that they can do. I think to a member is to censure them.
Well, I did want to bring this up for you all to think about. We can definitely revisit this the next meeting, but I kind of wanted to, I've been struggling with this item just because I know, I don't mind going in front of the microphone and answering questions. I just, I do anticipate there being a lot of questions if we have broad definitions that are, especially if they're different by profession. And I realize that there are differences and uniquenesses for the different professions, and in a lot of cases in other states specifically, there's some guidance, or at least a lot of states follow what their associations would highlight. But I kind of want to bring it to you, kind of framing some of the issues and seeing what your perspective is. So let's plan to talk about
You
that
in
at the
here
next
this
meeting.
afternoon? Okay.
The other two that I just wanted to highlight briefly for you for discussion at the next meeting, you have to go a couple pages deeper into the document, and that is items number 23 and 24. These both have to do with sexual relationships towards individuals. And so item number 23 would be unprofessional conduct to make sexual advances towards or engage in physical intimacies or sexual activities with either of the following: any person who is a client, supervisee, or student, or any person who has a significant relationship with a client and that relationship is known to the licensee. And so if you look across, there is some variety, a variation of this in terms of what exists in the different professions. Also looking at item number 24, making sexual advances towards or engaging in physical intimacies or sexual activities with any person who meets either the following conditions: has been a client within the past 24 months, or has had a significant relationship with a current client or a person who has been a client within the past 24 months, and that relationship is known to the licensee. A few of the different professions made recommendations that the standard should be changed from 24 months to, if the person has ever been a client, that should be the standard. Whether it's been 24 months or longer, it shouldn't matter. Another recommendation was from the I believe that's professional counseling, and that changed the standard from 24 months to 60 months. So instead of 2 years, 5 years. For social work, there was language that said if such conduct occurs with a former client after 24 months, it is the responsibility of the practitioner to demonstrate that the former client was not being exploited, coerced, and manipulated intentionally or unintentionally. So a lot of different perspectives on that. But again, kind of what we talked about, if there is an interest in having a uniform policy on this issue or a uniform position, there are currently several different proposals that are very different. So just wanted to highlight those two items for you to think about between now and the next meeting to see if you had additional thoughts.
Cindy and I also would like to point out that, especially like it talks about how one's client, student, or supervisee, like current, but then when you go down to the past, however, it just says client. And it would seem logically that if it was going to be wrong to do it with a client, supervisee, or student, then potentially it's wrong to do it with a client, supervisee, or student later as well. And those of us on the CRC, or I'm not on the CRC, but those of you on the CRC may remember a real big case that we had that involved this very thing, and we could take no action because literally because of the wording, the way the regulations were written. So I would just point out that it might be something to consider to make that uniform as well.
I know that we have a limited amount of time for board meetings. I have found this process to be incredibly valuable to hear all your different perspectives, and I'd love to just work through every item with all of you, but I know that we have other items on the agenda. So we did want to make sure to get this to you before the meeting, even though it did take a lot of time to get it to this point. We will clean it up a little bit more and send it back out to everyone and have it available for the next board meeting. And we will try to have some proposals, if you would like uniform language, what we might recommend. Of course, ultimately, you're the board members. If you want to make, recommendations or motions, we will follow your lead on this. But we're happy to suggest some things from what the investigators have seen, and maybe some alternative language that would get away from some of the things like treating, when we were meaning more of a broader application for some of those terms. So I'll stop sharing my screen. And I appreciate all of you and all of your thoughtful discussion on those items.
Can I
David,
just say
thank you
one
so
more
much.
thing? Oh, sorry. I was just going to say, I know that this seems like so many words and so much minutia, but I know Cindy and I deal with this literally every single day. And the members of the CRC especially can also say the incredible importance of these regulations. And so I genuinely appreciate the effort to try to make these more uniform, to try to make these more applicable. I just thank you very much.
I would like to
Yeah.
add to your comments. It is such intense work. When I think about what the complaint review committee does, and like you said, you're in this work every day. I just want to say thank you to David and to Emma for putting this rubric together so we can look at it and very easily compare and contrast and improve the way that we have these guidelines. And I want to also say thank you to the complaint review committee because your feedback is so valuable. And thank you so much for all the hard work everyone has done.
I agree.
We'll just
Well-
add, when we look at things, we didn't quite get to it, to look at the social media things that have been added, because that is something that has been new, that has come up, that we didn't quite get to it, but to look at the social media regulations that are there toward the end. And that's something that we're bridging. You're talking about the work that the complaint review committee that has come up and that might have come up in your own work, but to look at those, and that would be something that we'd hopefully discuss next time also.
Very good. Yeah, I would echo. I think it's extremely helpful to be able to look at this just side by side. And if we're not under any huge time constraints, just taking a chunk of this in each of our meetings seems like a really good use of our time. Just created such a great discussion.
Well, and to add to the kind of recommendations when we're all said and done. So adding that column piece where we kind of know where we think we're, especially for those talking points coming back. This would be really helpful.
Yeah, and I think just as a reminder for some of the members, some of these some of these unprofessional conduct regulations had not been updated in about 20 years. And so some of this language does go back quite a ways. And, you know, there were different professions that started becoming licensed, like the addiction counseling, the behavior analyst, that modeled after existing regulations. But I think I really appreciate all of you putting the time in and having good discussions about these. And I think we'll have a really good set of unprofessional conduct regulations when we finish this process.
And speaking for the newest member of this team, we as behavior analysts, when we first started trying to put this together, nobody had any background or experience in how to do that, right? So having the other professions as models was very, very helpful. And I like the uniformity across, I think, is really an important contribution. So thank you guys.
All right, we'll move on to expedited application review process.
Okay, so that was a goal for this meeting. Our focus really was mostly on the unprofessional conduct. So it's okay with all of you. Let's go ahead and just put a pin in that topic. We did have some really good discussion about the expedited application review process and what would be acceptable terminology. Our hope had been to kind of convert that over to regulation language, but we'll need to wait until the next board meeting to really have that before you for you to review.
Okay. That takes us to new business. Possible discussion on Senate Bill 63.
And I just kind of wanted to reframe this. I mentioned this briefly during my executive director's report. This was a bill that had to do with gender affirming care. It was passed by the legislature. It was vetoed by the governor, and then the legislature overrode the veto. We have received a few questions in the office in terms of, does this apply to BSRB licensees? Can you give us an interpretation? Can you give us guidance on what someone should do under the law? And our general position as the BSRB is that we don't provide legal advice to individuals. I am an attorney, but I am not the attorney for the board, and I'm not the attorney for people that would call our office, although we do want to be helpful. And so we do recommend that people review the legislation. It's not a very lengthy bill. It's only about 7 pages. And we do tell people that we don't ever encourage people necessarily to get an attorney, but it may be helpful for them to talk with legal counsel to get a better understanding of what the law is and how it relates to them. And so we did organize a special board meeting for the board to get together to receive some input from legal counsel, though that was in a closed session as attorney-client privileged information. I just kind of wanted to, since we had another board meeting coming up, I wanted to include it here as a possible topic. The information that was previously said by the board executive session, that is confidential. But if there were board members that wanted the opportunity to discuss the bill publicly, I thought that might be helpful if anyone does want to have any comment on the bill for the meeting today.
Is in the waiting. Mr. dropped off.
I had one question. My understanding is that all of us that have licensure at the independent level are authorized to treat anything in the DSM. And that would include gender dysphoria. So how do we square that with, as BSRB licensees, with this law that they passed? Because there's lots of trans children that are in treatment right now with mental health professionals. And they're supposedly authorized to treat that diagnosis along with all the others that are in the DSM.
Yeah, this may come down to what is the role of the licensing board in this instance, because we understand that people are going to have questions about some of those topics. The question, though, is, as a licensing board, can we take a position and can we give guidance on interpreting the law? And so, but I definitely do understand that people will have questions about it. So, people have asked me some questions about some of the different topics that are covered under the bill, and I realize that there is quite a bit that, in talking about things like surgical procedures or prescribing medication, that's generally not under the scope of practice of our practitioners. But there is some other terminology in terms of healthcare providers and healthcare services and things like that. And so I understand why people would have questions. I just, in terms of the role of the BSRB in this process and understanding the bill, but then also giving broad guidance, generally we have not done that unless something was very, very clear, such as if like a multi-state compact was passed and people had questions about the multi-state compact, or if it was an item that the BSRB was seeking and it got passed, and so it created a new type of licensure. This is a little outside of what we are usually used to working with.
I guess from a public perspective, I'd request that Tim get familiar with the bill, and because I can see a complaint coming at some point, somebody's going to bring this up, and the complaint review committee is going to probably need legal guidance as to the interpretation of the regulation and how it does or does not affect licensees. Don't expect an answer today, but Tim, is that reasonable for you to be ready to give us the guidance we will need at that point?
Yes, it is. One thing I might add, so there's a 10th Circuit case. It's out of Colorado. So Colorado law, and I don't know when the bill was passed, but it prohibits conversion therapy for minors. So looking at it from an opposite perspective, the U.S. Supreme Court just recently granted certiorari to that case. And so, I think we'll have a little bit of guidance from that case as far as, it's, not a one-to-one comparison because we're talking about, potential discipline. But at the very least, I think it'll provide a framework to how we analyze these questions, and it pits the professional standards, up against the state's public policy, which is the type of guidance I think that's important here.
Any additional questions or comments? All right. We can move on to a discussion on process to evaluate extenuating circumstances when an individual is seeking a supervisor from another profession.
Okay, so this topic it's rooted in the board's discussion in the fall about requesting a statutory change to provide a bit more flexibility on who could serve as a supervisor for the professional counseling profession. And like I said previously, unfortunately, the BSRB bill is not going to be able to move forward this year. And when there are items the board is interested in considering, I like to think creatively and see if the board may have a way to have input or take an active role in some of those topics in a different way. And so currently right now, for two of our professions, marriage and family therapy and professional counseling, the regulation does say that in most cases, the person providing supervision should be professional counselor for professional counseling, marriage and family therapist for marriage and family therapy. But the regulation also does say in extenuating circumstances, there could be someone who is qualified as a board approved supervisor from another profession who is able to provide supervision. The standard, though, is to show extenuating circumstances, and that is a term that is defined in the regulation as an extreme condition that would make someone unable to meet the requirements of the regulation or make it inadvisable for them to be able to meet the requirements. And so you need the extreme condition. And in terms of applying that standard to this process, we've done the best that we could as a licensing board. In general, we have very few instances to where someone meets that extreme situation, but I think there is also some room, if the board wanted to pursue this route, that the board could have a discussion on establishing sort of a working process for evaluating what would constitute an extenuating circumstance. So I wanted to bring this to you because here at the office, the staff works to implement the regulations and do what's according to law. But we've just had the training where we talked about the hierarchy, where we have statutes, regulations, and then policy documents or guidance documents in terms of processes. So if the board wanted to, in my understanding, this could be a topic that board members could discuss and give input in terms of establishing an operating process to weigh those requests for extenuating circumstances. We've brought you a few examples in the past, situations to where, let's say someone worked at a facility where there was nobody from that profession who worked at that facility and they had a strong preference for in-person supervision, or people who had requests based on they would like supervision in a very specialized area, or individuals who have said the cost factor creates a significant issue for them. And so we have done our best to weigh this, but we have not established a process with the board input in the past in terms of what process we could use for reviewing extenuating circumstance requests. So I guess the reason I brought it to you today is that if the legislation can't move forward until next year, this could be an area potentially the board could have discussion and help us as an agency with a more clearly defined process for weighing these extenuating circumstances, which might give some potential additional flexibility to people requesting these types of changes. So I wanted to frame this. I don't expect board members to have something ready as a proposal today. But like I said, I was trying to think creatively on this, and as based on my understanding, this would still be under what we're able to do under the statutes and regulations, is to define this process a little bit more deeply, and with board input, I don't see any reason why that couldn't occur. So I wanted to bring this to the board and see if you had any thoughts on perhaps considering that at a future board meeting.
Dave, I really like that idea. I would be in favor and be part of a work group that would help define that. I think from a recommendation standpoint, it would be helpful if Laura could participate in that too, since she's one of the professions covered, and appropriate staff like Leslie or and then any other board members who wanted to participate. But I think it would be a really good idea to do this in the interim.
I agree with that. It'll be a transition that we can work toward this going into effect legally. So no, I would be happy to work on that work group.
Okay, well, Mary, I think that's a really good way of putting it forward. As long as we don't have a majority of members of the board, and we just have a few more members volunteer, that wouldn't constitute a subcommittee or anything that we would need to have officially recognized and approved by the board, or, we wouldn't have official meetings or anything, but a few volunteers we could work with. So if there are any other board members who would want to volunteer to do that, go ahead and reach out to me, and then we can start to put something together and then have some discussions. But I appreciate you both being willing to do that, and I just thought this might be a creative approach that we could take to maybe address some of the concerns people had, and maybe the impetus for moving those things forward or attempting to move them forward this session.
Okay, very good. Next, we have discussion on digital seal.
Yes, this is not the animal, the seal. This has to do with our recent conversations in terms of moving to the Acela licensing platform. So you may recall that one of the main benefits and one of the things we're most excited about in moving to the new process is that a lot of our current things that we do will be integrated under Acela, and we'll be able to streamline those processes. So right now we do a lot of different steps manually. And one of those is when we issue licenses, we have a license on a nice cardstock, and we actually have metal seals in a stamping machine. And we have staff that goes and prepares each one of those and then physically mails those out to individuals as wall certificates. It does take quite a bit of time, and what we have been informed is that our stamping machine is so old that once it breaks, we will have to find a new mechanism. So what Acela would offer as an alternative, there are some agencies that have moved to having a digital seal where they can go ahead and basically have that ready to go on a certificate. And so you wouldn't need to go through all the process that we currently do use. I think the dental board, and let's say, do you recall the other agency that has the digital seal? I know we were able to see a couple of different models, and there's also some ways that if we would allow people to go ahead and do this themselves, there are some protections in terms of how many times somebody can access this. So that way, someone is not going out and doing things inappropriately. But it would be efficient. And I think they wanted us to go ahead and have that discussion with the board to see if board members were supportive of allowing a digital seal for the certificates. So Leslie, do you have anything you want to add to that as far as digital seal?
Yes, I think they should, whether or not you would find it appropriate to have a digital seal, and if we have a digital seal, allowing people to print the certificate themselves rather than requesting it for us to print. Those were their two questions.
So I guess right now we allow people to print their wallet cards. And so if someone's licensed, they get the email that says this, and then we go about making them an official, at least the first time they get licensed, we have the official wall certificate. And then we go through and do a whole batch of those. In this scenario, there would be an option for people to go ahead and print out their own certificate. And there'd be a limited number of times potentially they could access that. So there'd be some protections in place.
We could, yeah, you don't have to, but you can. Like now they have to pay $20 for a duplicate wall certificate, and we print it on nice paper and put the seal and everything. So we could either continue to do that with a digital seal, or we could allow them to print it themselves.
And if you're interested in seeing what some of these look like, we could check to see if we can get access to those to show you. But they wanted us to have a discussion with the board about that, because it does say in our statutes, the board does approve a digital seal, or it doesn't say digital, but the board does approve a seal for the agency.
Right. And you can do that in color as well. There's one that's black and white and one that's in color.
Well, sounds like one way or the other, you're going to have to either move in that direction or replace your current.
Yes.
Comments
So-
from the board?
Just a question, David, I have no problem with the digital seal. I think that's fine to go that way. My question is for people that are just new into their profession, are they still able, or will, in your opinion, they still be able to pay a fee to get one done, I'll say, prettied up in the office?
Leslie, do you know if that's something that they would allow us to do?
Yes, if the board decided that you want to use a digital seal, but we always print them, we could do that. Or you can allow them to print it, but still charge them, and then they only can print it off once. There's different ways. I mean, we can set up, I think, the programming the way the board feels is appropriate.
I'm an old man. I got my license back in 1974. So I think, when I got the license, I was real proud of it, hung it on the wall, blah, blah, blah. And I think moving to the digital seal is the correct thing to do. But I think giving those people that are just entering the profession, for them to display, if you would, their pride, that they should have the option to go ahead and purchasing or acquiring a pretty one from the office.
Right.
I agree with Jim. I think that's a nice thing to do.
Me too.
Really do too. I'm fine with a digital seal, but to be honest, I'm proud of my licenses. They're on my wall.
Right?
Okay. Well, it sounds like there's
Uh,
consensus.
Just so everybody knows, in retirement, all those go in a box. They're still framed, but they're in a box now.
Right?
Okay, well, we will also start exploring a backup option for our current mechanism with our stamped seal. Because I hear the board, and it does sound like authorization for a digital seal is by consensus, but there would still be a preference to have a way for people to have a nice certificate, cardstock, and have a more permanent seal than a digital seal, or not more permanent, but I think I understand what was being conveyed. So we'll go ahead and research some options for that.
We'll still print them and send them with the digital seal. Right? That's how I understood it.
Would it be a digital seal for both? It's just one would be on the cardstock and one would be on they can print it themselves.
I think that's important for clients to see.
Okay.
Do we want to allow them to print their own, or maybe we don't have to let them print the wall certificate? It has no expiration date. So that was kind of an option. So they don't have, we can say you have to request a duplicate wall certificate from the board office. We don't have to allow them to print it. So, because a lot of people have two offices.
We can give them the choice.
Yeah, I think it's nice to allow people to print one, particularly if credentialing needs something, and it's an easy access for them, and it sounds like there's safeguards from any type of abuse that would occur in that situation. So
Very good. Next item is a discussion on creating a possible RFP for expert application review services.
Okay. So you may recall about 3 years ago, we had a number of discussions about wanting to define an expert process for reviewing educational materials for applicants if they came from a program that we were not familiar with. Usually these are out-of-state programs, sometimes out of the country, and not accredited by the national accredited bodies. And we defined a process where we had individuals serve as experts who were licensed as clinical level licensees in the professions, and they were able to assist the board, and still do in many cases, to review these programs. But for some professions, we received a number of applications for the same profession at the same time. And since we have a limited number of in-state experts, that can lead to a backup, because usually the experts can only work on one review at a time. And so in an effort to avoid any kind of delays and move as quickly as possible, we explored options about companies to see who could provide services along these lines. And there was a company that is associated with the National Board for Certified Counselors. It's known as CCE, the Center for Credentialing and Education. And they are able to provide reviews for us for the professional counseling profession and also the addiction counseling profession. And they have sufficient staff that they're able to do these types of expert reviews, however many we need to send to them at the same time. So in my opinion, it's been very successful. They also have a flat rate that they charge us, which is comparable to what an in-state experts generally charge us, even though they're at an hourly rate. And so we have been under an agreement with CCE for about the last 2 years. The quality of their reports, I think, has been good. I think their processing time, they have said they would turn it around in at least 6 weeks. Where we are at is we have had a number of these reviews that have been processed by CCE. But for us to continue to work with them or with some other vendor who does something similar, I think we will need to put out an RFP, a request for proposals, to see if there are other entities that would be interested in providing this service. And then the board could make a decision and review proposals. But it would be my recommendation, if you're supportive of this process, how it's been working so far, that we would talk to the Office of Procurements, take steps to go ahead and write up an RFP and then put that out to be competitively bid. If we can get something similar, I think that would be great.
For all professions.
If we could do it for all professions, that would be great. And I think even if we couldn't get it for all professions, as many as we could get, it's been very, very helpful to have what we've had so far. So, but there is a limit. You can only use certain vendors up to a certain dollar threshold before you need to have something competitively bid. So we still do have some time before we would run out on how many CCE could work on, but I think it would be important for us to be proactive, and if that's something the board would be interested in doing, we could start to take steps in for it. Wanted to see if the board would be supportive of me talking to the Office of Procurements and putting something together, and if there would be maybe a couple of board members that would be interested in reviewing some of that language, I'd be happy to have a couple extra set of eyes on it too.
I support you going out for an RFP process, and I'd be happy to be a part of that conversation.
Is there general consensus towards moving in this direction?
Makes sense to me.
Is that all you need?
Yep. If there's any board members who think about it afterwards and would be interested in taking part in the RFC process, or request for proposal, RFP process, please let me know. I'm happy to kind of share this process with you. It's really interesting. I've only done it once before. And so if you'd like to play a role in that, just contact me and I'll let you know kind of the steps that I'll be taking to make these arrangements.
David, I'm happy to help.
Okay, thank you.
The next item on our agenda was a possible executive session.
Yeah, because of the last meeting, with us having executive sessions for the board to receive input from legal counsel, I wanted to give the board the opportunity to do that. I know we're close on time. We're only about 10 minutes away, but that's originally why I had asked for it here. If there's no interest in executive session, we could move forward though. Okay.
If there are no new pieces of information from a legal perspective that we need to follow up on, I would say no, not necessary.
Okay.
I agree.
Thanks.
Yeah, I mean, I think the only thing that I could think of, David Stevens outlined a few issues he asked to be reviewed. I think that would be the extent of it, but we could do that, or I could circulate information to the board, whatever the preference is.
If the issue comes up, I mean, I think I was highlighting those as items that I think were prospective potential issues, so it's fine to hold off until we've got an actionable need.
Okay.
All right, very good. Our next regular board meeting will be May 12th at 10 a.m. It will be a hybrid meeting. I would now accept a motion to adjourn.
So moved.
Thank you.
Okay.
Thank you. Have a great week, all.
All right. Thanks, everyone.
I'm happy to